2 today, and we would love to not waste any time on silly questions like that one that I came up with. So we are going to record this meeting. Hopefully you just got that notification. There will be a lot of folks who won't be here. So just keep in mind that if your camera is on, you're probably going to end up on the recording at some point. So thanks for being here. Continue to throw those in the chat. But we are going to get right in. We have a lot of information to get through. And so we ask that if you have clarifying questions throughout, pepper them. Go ahead, throw them in the chat. We will stop Wendy and get her to clarify those questions. If you have larger discussion questions that you want to get to about our topic of food and SNAP, still throw them in the chat, but we might wait until the end to discuss those or hang on to them, and we'll hopefully save some time at the end to have a larger conversation about some of those bigger questions. Sorry, gonna hit mute there. So I'm going to introduce Wendy now. Wendy Peters Moschetti is the Executive Director of Nourish, Colorado, a Denver-based, statewide focused organization that strengthens connections with farms, ranches, and communities so that all Coloradans have equitable access to fresh and nutritious food. Wendy actively works on state and federal policy priorities that advance Nourish's mission and collaborates with hundreds of partners across the state. Prior to this position, Wendy was a social worker, project manager for rivers and watershed initiatives, a coordinator for a research project on community gardens, a manager for Healthy Schools Coalition, and she ran her own food policy consulting firm for 6 years. Wendy currently holds appointed positions on the Colorado Food Systems Advisory Council and she's on the board of the National Sustainable Agricultural Coalition, NSAC. So Wendy is our expert today who's going to walk us through things that have been going on as it relates to SNAP for the past couple of months that you've surely been hearing about. So if we could all give Wendy a warm technological welcome.
Hello. Hi, everyone. Hi. Hey, okay, good. So David just give me a thumbs up, like sound, audio, we're all good here. Okay, great. Hey, everyone. I am super flattered and touched and happy to be here and joining you today. In another setting, I wish I could like see you all and get to know you all. I think it's really incredible that there was so much interest in this topic, and I hope I do it some justice. And it's going to be a lot of kind of hard stuff that we're going to talk about today. So we're talking about things that are across the board pretty damaging and hard and scary around food security and food assistance. So I'm glad to be here in community with you all through this conversation. And do welcome, as David said, sort of just like clarifying questions as we go and then more discussion questions at the end. So I'm going to start by sharing my screen. Okay, and we get David thumbs up. You can see okay, great. Okay. So thanks for that. I don't know where you drummed up all that information. Thanks for that amazing introduction, David. So we're here to talk about the impacts of, there's like 3 different names for it, right? But budget reconciliation, HR1, or I will probably never say this name again, but the One Big Beautiful Bill, which was sort of the name adopted by the White House and Republicans for budget reconciliation. So today we're going to talk about the impacts of that budget reconciliation, HR1, on farm food and nutrition security, specifically nutrition security and impacts made through the SNAP program, specifically Supplemental Nutrition Assistance Program, formerly food stamps, and the ripple effects that proposed cuts to SNAP have across a variety of issues. So this is how we're going to spend our time until 1 o'clock your time. I'm in the morning. Is I'll do a little bit of quick introduction, just a little bit more about like Nourish Colorado and what we do. David, your introduction was great. I'm going to move into a very brief, hopefully simple survey on the platform called Menti, which we'll chat in a minute just to get oops, sorry. There we go. Thanks for the mute. Just to get a little bit better sense, even though we can't sort of unmute and have a conversation necessarily about who you are and what you want to know. I'm going to go into a little bit more details about exactly how we keep talking about SNAP cuts to SNAP through this budget reconciliation process of HR1. And I'll go into a little bit more detail about what exactly those proposed cuts are and when they might be happening. And then I'm going to go into a little bit more information about, because of those proposed cuts, what are potential impacts on health? What are potential impacts on farmers? What are potential impacts on food security, even outside of like the SNAP program? And what are potential impacts on food access in general? And then I'll close with a little bit about like, what the heck are we doing about it? I know you all have a lot of things that you're doing about it. I'll just share a little bit about like, oh my gosh, even here at Nourish Colorado, what the heck are we doing about it? So that's how we're going to spend our time together. So really quickly, David just shared our mission at Nourish Colorado. This is some of our team on my coworker's farm in Northern Colorado. The one thing I want to add just about who we are and how we get work done, and that's the bottom half of the slide here, sort of like the explanation of our mission, is that so we truly are statewide. We work with thousands of individuals and organizations in every corner of the state, in rural, in frontier counties, in urban and suburban communities. And we implement programs, which I'll tell you about in just a second. So, but through our work of in community, in partnership with others, running programs and initiatives, we are constantly learning and observing and watching what is working, what isn't working. And that becomes the fuel for our policy advocacy fire, right? And then we have a contract lobbyist at the state level. As David mentioned, I'm on the board of the National Sustainable Agriculture Coalition, along with Edna from Rafi. And we do a lot of federal advocacy as well, but all based on like this learning with these thousands of partners we have across the state of Colorado about how do we make this work the norm? How do we make what we're doing permanent and easy and accessible for everyone that we do? So that's kind of the how we get to our mission. We do it from programs through policy to permanency is how we talk about it. So then quickly, what the heck do we actually do? So we have sort of 4 content teams at Nourish Colorado. So we manage statewide nutrition incentive programs. So the most well-known is probably our SNAP incentive programs. So double up food bucks, for example, something y'all might be familiar with. We run a couple of different SNAP incentive programs that are geared towards stretching individual households' food dollars, increasing food dollars, specifically to buy more produce and most often to buy local produce and driving those dollars back to local farmers and local economies. So we have a few different of those sort of produce access nutrition incentives that we support and manage, and then local partners implement across the state. Moving to the bottom, healthy food and institutions. This is work led by our chefs and registered dietitians. We work primarily with public K-12 school food, but early care and elder care and hospitals, other institutions a little bit as well, to do not just culinary training and menu planning and budgeting and forecasting, all that, like with kitchen staff, but also working with local farmers and ranchers through all of the technical processes of like, how do we work together? How do local agriculture work with these institutions that are feeding really critical calories to Coloradans? Then in the top right, nutrition education. Until September 30th, we will talk about this. We are the state's SNAP education and implementing agency. So that means we contract with our human services, fully federally funded, to implement nutrition education in low-income communities where there's high percentages of SNAP eligible individuals. I will cut to the chase. You'll see this in the presentation, but SNAP education was fully and immediately cut through the budget reconciliation process. So we employ about 16 people through the state of Colorado, and their funding is fully done September 30th. So that will be a pretty significant shift in our team and our strategic plan that we're doing a lot of work on. That's a whole other conversation about how we continue that. And then lastly, farm and food policy, that again, building on incentives, institutions, education. We are constantly doing advocacy at the state and the federal level. Okay. So I am now going to stop sharing this and I'm going to move to sharing to my mentee. So if someone could chat in, please, the mentee survey. So Mentee is just a platform. I'm sure some of you have used it, some of you haven't. It's just a way to do really interactive survey work with individuals on a line, unlike because you can all see the results like right then and there. And there's a lot of different types of questions you can ask. So I want to make sure I'm in present. This is where you're gonna have to check me. So I chatted, it looks like people are in there. So I'm in present mode, correct? So it's working. People can, okay, you're just gonna have to interrupt me. So, and I know some of you aren't on a computer or you can do this on their phone. You may not be on a phone that has access to it. No worries. I just wanted to have a chance to get a little bit of feedback from y'all before we go any further. So my first silly question is more like, how much do you love Menti? Have you ever used this before? And this is just an example of like the types of questions you can ask in Menti. So Menti is my favorite as well, or it has its place, or simmer down, not that awesome. Um, so go ahead and chat. And so the way Menti works is you do one question at a time. So like we all answer one question, look at the results, and then I move to the second question, and then we all look at those results, and we all kind of move forward together one question at a time. And David, I see there's some chats, but you'll let me know if I need to see these, correct? Or if
Yeah,
we're
so
having
far
any.
people are just some people hadn't heard of it before. So you're
Oh,
introducing folks to the good news that is Menti.
okay. And there's lots of ways to do this. Like I just chatted in the link, but there's a QR code. You can always go at the top here. You can go to menti.com and just chat in the code. There's a few different ways to access Menti. And as you'll see, I didn't get that creative with Menti today because it was meant to be pretty quick. But there are tons of different kinds of questions that Menti has that you can have people respond to. So I'm going to go ahead and move to the second question. Okay, so second question. And this is a word cloud. So this is Jen, if you could each just type in like a word, you can do two if you want. What this is going to generate is just a word cloud. So I just kind of want to know how you feeling today? And if you chat in, they'll start popping up as a word cloud. Trying to get a beat on kind of where we're at in the literal middle of the work week. I never thought about that, David. We're now officially over halfway there. Fair. And so I don't know if you all are familiar with word clouds, but the word gets bigger. The bigger it is, the more people use that same word. So for example, looking at this Menti, I would assume maybe one person said calm, but multiple people said tired because it's bigger. Rush, thoughtful, encouraged. I see this. I'm seeing words that feel like me and my body every day. A big mix of like some overwhelm and some tired, but also some activated, some motivated. I'm definitely anxious, but for me, my anxiety tends to turn to action, frazzled, super fair. Okay. I'm going to now I'm going to move on to the next question just so we don't belabor this too much. Oops. Okay. So, and again, I'm going to do this really quickly. So I'm so sorry so we can get into the meat of the conversation. But if there's just like something off the top of your head, not promising that I will or can cover it, but if you could just share one thing you hope I'll discuss today. And just to note on this as well is this is still active. So I might move on to the next question, but you can keep chatting. And if there's something um that I see coming up here, I will look at these also, not now, but also later. And if there's something that y'all are asking for that I don't talk about, I can follow up on that, right? If like, I actually can't talk about, but that has some really good follow-up information. I can certainly follow up with the Rafi team to share that. So, because I will tell you, for example, right now, um, I'm not going to spend a lot of time, for example, on practical ways for communities to work around these cuts. Today is mostly around like level setting about like what is going on. And I know that can be super frustrating. I'll share a little bit at the end about kind of some things that we're doing, but there's a lot more to talk about there. Yep. Who stands to, well, I can answer. Who stands to benefit from all these snap cuts right now? Wealthy households. We'll talk about that. Okay. Is that going to work? Okay. Okay. So please keep chatting these in. We'll address that. Yes. And I will, and a caveat to this as well, I'm going to be offering some Colorado examples on some of this stuff because it's what I know. So please know, I'm not saying that we're doing it the best or better or the only, it's just what I know. And so I might offer some examples of like, well, here's some kind of things that we're working on that maybe you are too, or maybe you could be. So caveat, it's not because I think Colorado is the best. I just might share about like what we're doing about like literally tomorrow, for example, our state legislature is going to a special legislative session to address some of these cuts. We might be able to talk about that. Okay, this is very helpful. And as you can see, it keeps going, keeps going, keeps going. Where folks can find food alternatives. Um, timeline, yep, okay. These are great. Okay, so great. And a caveat, yes, some of these I'll address, some of I won't. I can follow up with stuff that I can't. I love it. So please keep it going. Um, and then last question, and then I'm going to move back to my presentation, is I also just want to sort of acknowledge and honor there are a lot of folks on the line right now, and I don't know you, right? So there could be folks on the line right now that are using SNAP benefits to shop, to buy food for your family. And this is like a really personal and really scary conversation. Um, so I just want to acknowledge that. And they're also, you can be personally impacted by proposed SNAP cuts because you're also losing your job. Our organization is laying off 4 people this week that are entirely SNAP Ed funded. And I see that's already going on right now. And that is incredibly personal. So um, I just wanted a chance to share, like, if there's something that y'all are like really most concerned about, I want to know and I want to understand better. And I want to know better about how we talk about this work. And like when we keep talking about this is helpful, I think, for all of us to know, like, what is it we need to be addressing and what is it we need to talk about. So, um, also a warning on this is not necessarily that I'm going to address or respond to all of these right now, but I think it's really helpful for all of us to see, and we'll share the results of this Menti back with you. I think it's helpful for all of us to see this is what this really feels like, right? These are things that people are really worried about. Yeah, and working at a grocery store, losing customers and the people that you love and see every day, maybe not being able to come in anymore. Um, yeah, 100%. So people who are sharing too, there is no expectation to share, but also I really do appreciate those of you who are sharing. This stuff is hard. I am having a very hard time talking about it. Um, so thank you for taking the time. So what I'm gonna do is I'm gonna please keep chatting in. This is just gonna stay open even if I'm not presenting it. Please, David, if you find out some that's wrong, let me know. But I think people can keep answering. Um, but for now, I'm gonna go back since it is already, well, I said 10:20, apologies. 12:20 where you are, I'm gonna go back into our presentation. So as I go into share the presentation, David, are there any other chats coming in that I should be aware about or anything else I need to change?
No, I think you're good.
Great. All right. Thanks, y'all. So also, sorry, you introduced me. That's fine. I usually do like to add, sorry, before I get forward, I usually like to add who I like really am. So I'm a mom. For 1 year, for this 1 year, I officially have 3 teenagers because my youngest just turned 13 and my oldest is just now turning 19. So I have 13, 17, 19. For 1 year, I have 3 official teenagers. And right now I'm sitting in a college not dorm room, a college academic building in Missoula, Montana. And I just moved my daughter into school yesterday and Monday. So I'm calling in from Missoula, Montana, but I do live in Boulder, Colorado with my husband. Sometimes I forget to throw that in there, with my husband and my 3 kids and my 2 cats and my dog and my fish. So that's just a little bit who I really am here today. So let's then talk about the not so fun stuff. So here's what I've been told. So I hope this is true. I've been told that y'all, and you've been doing a lot of these learning series, and I'm not going to go into like, what is HR1? What is budget reconciliation? Like, you all have that. There's background information. So I'm skipping that part. And there's a lot out there written if you want to read more, kind of thing. Also, I should say, if you want to follow us at Nourish Colorado, so we've done statements on budget reconciliation, what happened, what it is. We've initiated a 6-part blog series on like, what is budget reconciliation, the impacts of it, that kind of parallels some stuff I'm going to talk about today. We've published 4 of those 6 blogs on our website. So like, just as a resource, if you want to, you can go to our website, follow us, stuff like that. So even though you know about HR1, budget reconciliation, to some of your questions about like who benefits from these cuts, and if anyone, I don't think anyone on the line does follow, but if anyone follows us, you will see that I have shared this graph like a million times through social media and blogs and webinars, because I think it does a really good job of showing just how inane and damaging and irrational this budget reconciliation process has been, and how incredibly lopsided it is in terms of what is and whom is going to hurt and who is going to benefit. So just a really high level summary, like what this graph shows is the bottom shows where cuts are going to be made, right? And to what degree and how many billions. And the top chart shows where you're going to see gain to pay for what, right? Like where, basically the where is going to benefit. So the high level takeaway from this, and I'm sure a lot of you have heard this already as well, is that primarily Medicaid food assistance through the form of SNAP, formerly food stamps, and green energy environment programs primarily will be experiencing deep decreases in funding over the next 10 years through 2034 in order to offset the costs of incredibly significant tax cuts. So through a few different things. One is extending the Tax Cuts and Jobs Act from the first Trump administration. And also there are significant additions to those tax cuts that are, and there's a lot of analysis on this. If you want, I'm happy to share some later, but significant additions to tax cuts that deeply disproportionately benefit not just wealthier households, but primarily corporations. And that's really it. And then there's also significant increases for defense and for so-called border security. To be honest, I don't like using that word. I think our borders are secure. It makes me deeply uncomfortable to talk about border security in that way. That's their language. And the one thing that is not on this graph, but is significant, is budget reconciliation also proposes about $54 billion in new subsidies for specific commodity agriculture. So not for small and diversified farms, they're totally left out of this game, but that's not on this chart. But a significant increase is also for commodity agriculture through additional new and extended and expanded subsidies, essentially. So that's just super high level, like where we're making cuts to pay for what, because budget reconciliation is literally supposed to just reconcile, right? It's not supposed to write policy and make new programs. It's supposed to just reconcile, so you align your revenue and expenditures. But since the White House and primarily Republicans wanted to deepen these tax cuts, extend them, they had to pay for them somewhere. And they're paying for them literally on the backs of our environment and of poor people. And it is incredible. It's a projected $3.3 billion increase in the deficit over the next 10 years. So it's also fiscally irresponsible and entirely manufactured, right? This is an entirely manufactured issue that we're talking about here. Okay, enough on that. So my next slide here is also, I don't know this information for North Carolina, I'm so sorry, but I just wanted to show as an example that also these are not wanted. So there may be some polling that has happened in North Carolina or other places that I think is really important to elevate. So I'm just sharing what we have in Colorado. So through recent polls through our Colorado Health Foundation, so it's our largest health foundation, does what they call like a pulse poll. And then an advocacy, a peer organization of ours called Healthier Colorado, specifically because of budget reconciliation in early June, issued a poll that oversampled rural Colorado and oversampled Republican districts to get a sense of like, who wants this, right? Cuts to SNAP and cuts to Medicaid. Like, how do Coloradans support this? And the bottom line here, as you can see on the slide, is that most people really, truly don't. Whether you're in like, red district, blue district, Democratic, Republican district, rural, urban, these numbers are really, really stark, that the vast majority of at least Coloradans support SNAP. They want them to stay the same. They support Medicaid. They want Medicaid spending to stay the same or increase. They think that these cuts are happening specifically to take money away from these programs, not for some other need. And most people are less likely to vote for a candidate who cut Medicaid specifically. So this is information that we keep coming back to in our organization. We're going to continue to use it in our advocacy work. People didn't ask for this. This did not come from the American people. Okay, so I'm gonna keep moving. Okay, so now the nitty gritty. And David, please, like if I'm moving too fast, if there are questions, please just throw your hand up. You interrupt me anytime, okay? So what the heck happened, right? So what are these specifics around SNAP and how it will be cut? So, and I see there's some questions about this, so I hope I go into enough detail, but I'm happy to send more information. Um, oh, and also I should say your department, I think it's called Health and Human Services in the state of North Carolina, but they did issue a really great like 2 to 3 pager that talks about these cuts specifically in North Carolina. And I have a link to that. I think it's on the next slide. So we can go through a little more depth in this. But here's when we keep talking about SNAP cuts, right? Like, what are we talking about? I will start by saying none of these cuts are going into effect within the next 12 months, right? We're not talking right now. These are going to be phased. These are proposed cuts. Um, I will also point out that the vast majority of significant cuts will happen after the midterm elections. And that is incredibly intentional, right? So I think that specifically those in the Republican Party, some of them are very aware that these are not popular changes. And it is not a coincidence that several of them will go into effect after midterm. So people aren't really going to feel the hurt until after midterm elections. Um, so just something to keep in mind, which doesn't feel good, but it's true. So this is what happens. So essentially, if through a variety of different ways, the amount of SNAP benefits and for whom are going to be changed, and it's going to become very much more expensive for states to administer the program. So how SNAP works everywhere is that SNAP historically, the federal government pays for 100% of the actual SNAP benefit, right? The actual cash on the EBT card is 100% federally funded, but it's managed through the state, like a state Department of Human Services, typically. And in our case, I don't know about y'all, in Colorado, it is county administered, right? So like money goes through the states, and then each of our counties is doing all of the processing, right? And input all the eligibility, all the enrollment, all that, it's county administered. Historically, 100% of the benefit is federally funded, and historically, the administration of it, so that cost for the state and the counties in Colorado to administer the program, the state of Colorado pays half, federal government pays half. That's true in all states, right? So here's what's changing now. So this isn't a direct cut to benefits, but will absolutely impact states' ability to enroll, to reach and enroll SNAP, and as many SNAP shoppers as they always have. So the 2 ways they're going to do that is now beginning in fiscal year 28. So that starts October 1st, 2027 is the beginning of fiscal year 28. Depending upon your state's error rate, your processing error rate, which I'll explain, it will shift. I typed this wrong. I'm so sorry. Maybe ignore what I typed. Depending upon your error rate, your state will have to pay a certain portion of the actual SNAP benefit. And so I actually don't know. I didn't look up what your error rate is in North Carolina. I'm so sorry. So I don't know exactly what that is. So, and it's going to change anyway, because now states are all scrambling to be like, how do we fix our error rates? How do we get our error rates lower? So we have to pay fewer in benefits. So I also do want to know that processing an error rate is not about fraud. It is not about waste or abuse at all. These are honestly very typically occurring issues that just occur with any complex program, right? So an error rate does not mean, ooh, people are giving out SNAP benefits to people who don't deserve them. In fact, it typically means the opposite, right? That maybe there's an error rate that someone actually was eligible for SNAP and didn't get it, or was kicked off too soon, or wasn't enrolled early enough or fast enough. So processing error rates can look lots of different ways. It has nothing to do with fraud or a state or people getting SNAP that shouldn't get it, right? It was just an indicator that the federal government came up with that they decided they could use as a metric, right? So that's the first one, is that starting October 1st, 2027, depending on your error rate, states actually for the first time ever paying some of that SNAP benefit. The other thing that is going to happen beginning October 1st, 2026, so for fiscal year 27, is that those administrative costs will shift. So now 75% of administrative costs will go to states instead of 50. So the estimate I read for North Carolina, because of these costs, is that this could increase costs to the state of North Carolina by $700 million per year just to keep SNAP running in the ways that it always has. And this isn't, I don't know exactly the number for North Carolina. The second bullet is that the average additional administrative costs are going to be about $45 million for states as they increase those that administrative cost share. So I don't know about you all, but like this is not money that the state of Colorado has, right? And I doubt North Carolina is just sitting on $700 million to be able to pick this new annual tab up, right? And we'll talk a little bit more about like what are we doing about it. So it also does a few other things. So it eliminates state waivers for high need areas. So typically because of their work requirements, states are able to say, oh, this area is like very economically depressed. There's like, for in Colorado to be like the coal industry, whatever, like left, right? There's oil and gas left this area, for example, high unemployment. You cannot apply your job your job requirements here. We apply for a waiver, though that will not happen anymore, right? No more state waivers. A huge one is the Thrifty Food Plan, which I don't have time to go into, but the Thrifty Food Plan is the federal government's way of determining what does it cost to eat thrifty, right, in a month? Like, what's the cost of a food basket to feed your family each month? And is it the lowest cost food plan? And that's how they determine what a monthly allocation is for SNAP. They have now ceased any formal updates to the Thrifty Food Plan, right? So, like, there are some food inflation tweaks on like a monthly and an annual basis to the Thrifty Food Plan, but typically what happens is every few years they do a big update to like make sure that the cost of food, like we're really reflecting the cost of food, right? Changes and cultural changes, eating changes, health changes, cost changes. And now they've said, nope, we're not doing that anymore. We're not updating Thrifty Food Plan. So SNAP allocations are kind of going to be stuck where they are. A big change is work requirements. So, and this will be the same for Medicaid in a minute as well. So there are work requirements for if you're called an able-bodied working adult without dependents, right? So like you could get a job, you don't have kids or older adults you're taking care of. And right now, if you're between the ages of 19 through 54, you do have this work requirement that triggers after 3 months. You have to demonstrate that you're actively volunteering and actively seeking a job or actively working. Like I think it's 80 hours a month, I think. They've increased this now. So now, if you are the ages between 19 through 64, you have to abide by these work requirements. So it's really expanding who is now going to be have to follow these work requirements. A big change too in SNAP eligibility is for immigrants, like immigrants that are even refugees, asylum seekers, will not be eligible for SNAP benefits that were in the past, even without other documentation. Okay, I'm gonna keep rolling. Okay. Um, we're good. We're good, David? David?
Yeah, Wendy, I put this in the
Okay.
chat, but
Oh,
the average error rate in the United States in 2024 was 10.9%. North Carolina
oh,
was 10.1%. And in
oh.
the bill, if your error rate's above 6%, that's when the kicker starts to kick in on how much of the benefits you pay. So North Carolina, pretty much right in the middle, but it's still above that 6% error rate.
Yeah, thank you for getting that. That's incredible. And that is a lot of work that North Carolina would have to do, right, in the next year or two to get down those error rates if you want to pay less in SNAP benefits. That's a lot of, and again, some of these are just naturally like typically occurring error rates. It's a lot of work to have to do and with not resources to do it, right? Okay, so now what I want to move into is just okay, so what does this all mean? Who does this affect and how? Like that's what happened and now what's going to happen. So I'm quickly going to look at impacts on like food security, health, farmers, and food access. Okay, so the what? Oh, I don't know why that says that. So SNAP and food security. So okay, great. So like all these changes are coming, right? So these changes and proposed cuts, like what I took from your Department of Health and Human Services, is because of these changes, the estimate is that pushing on 800,000 Carolina families will lose some or all of their SNAP benefits. Because of some of these changes, like to the Thrifty Food Plan, things like that, there might be a reduction of $118 a month on average of like what households are receiving. And again, this is on average. It's very different if you're a single older adult versus like a young parent with a couple kids, but on average, benefit reduction. Approximately, um, wow, that's funny. I'm so sorry. I have two different numbers. Approximately 375. Ignore this bullet. Sorry. The 375,000 North Carolinians could lose some or all of their SNAP benefits. I'm going to go back and correct that. I'm so sorry about my conflicting numbers there. I will change that. Um, because of these changes to the Urban Institute did this whole study on a modestly priced meal would cost 58% more in North Carolina than what the max SNAP benefit in North Carolina actually is. So we're also just seeing we're not keeping up like with what it takes to like feed your family. As I mentioned, the entire SNAP education program will end effective September 30th, which is a huge, and I'll talk about this under the health slide a little bit, but um, a huge tool in preventing food insecurity as well. And then the last thing I want to say on this in terms of food security, that's really important is that it's not just SNAP, right? Is that Medicaid, there is a very, and I actually don't know, don't know if North Carolina does things like direct certification from Medicaid to school food, but without knowing those details, in many states, there is a strong alignment and co-enrollment, co-eligibility between SNAP, WIC, Medicaid, and free and reduced meals at school food, right? So if you're eligible for SNAP, for example, you're automatically eligible to get free and reduced meals and school food. If you are eligible for SNAP income eligible, you are automatically eligible for the WIC program, Women, Infants, and Children. So, so with cuts to both Medicaid and SNAP, and changes to eligibility and different programs, we are like advocates are projecting that this is really going to impact programs like WIC and school food as well. And that's going to be added paperwork, added confusion, decreased eligibility. So you might be kind of triple hit, right? If you're a household that gets SNAP benefits, you're also like a WIC mama and your kids eat free school food at school, you may see all of these be altered. So it's many, many attacks, honestly, on nutrition security in our families. Okay, next slide. Okay, I know this looks like a lot, but I'll go fast. So then impacts of cutting SNAP and like the health of Americans. So we did mention this as well. There are significant cuts to Medicaid that are proposed. I'm not going to go into a lot of that. That is not my area of expertise. But the budget reconciliation proposes over $1 trillion in cuts to Medicaid over the next 10 years that also cuts the the Affordable Care Act. So this number I know is accurate. The projection is that, over 270,000 North Carolinians would lose their Medicaid benefits and access to health care with these cuts. A lot of these changes are due to totally new work requirements. So I mentioned those work requirements for SNAP now expanding. If you're 19 through 64, they have now, for the first time ever, there have never been work requirements to get Medicaid, have instituted the same work requirements are for SNAP now exist for Medicaid. So if you're 19 through 64, you have the same like 3 months, and then you have to document all these different things you're doing to get a job, look for a job, or volunteer. And that has never happened. So it's going to be a whole new thing for states to implement. They've never had to do this, right? To implement this kind of requirement. And this is just not how Medicaid has ever worked. It's healthcare, it's preventive, it actually saves costs, right, for the country in the long term. And now we're going to make it harder. So I could go into, I think we can all kind of like guess and surmise that how loss of access to preventive care affects health. The other things I did want to mention here too, in terms of impacts to health because of these cuts, just by cutting SNAP itself, right? When you are food insecure, you are much more likely to have an chronic illness, to skip doctor's visits, right? To delay Medicare, to not seek the medical care and the medication that you deserve, right? And there's a lot of really interesting data about how SNAP participating households specifically, so not just low-income households, but those who participate in the SNAP program in general save $1,400 a year in annual healthcare costs, use medications more consistently, and do attend regular well visits with their doctor. So there's something going on there about how having that touch and that contact and that support actually has sort of these ripple effects and just really caring for your family in other ways and feeling like you have the support to do so. So we're cutting a program that's known to decrease healthcare costs. And the last thing is we're entirely cutting another program that has incredibly strong evidence, as documented by the US Department of Agriculture itself, on how it prevents and saves healthcare costs, and that is the SNAP education program. So SNAP Ed is every state probably, and the nation's largest, highest reach public nutrition education program, right? This is the biggest there is. It's available not just for SNAP shoppers, but also in, as I said before, SNAP eligible community, like where there's a lot of SNAP eligible people in a community. And the USDA has commissioned significant studies in the past on the impact and importance of community-based nutrition education, and found that for every dollar spent on community-based nutrition education saved up to $10.64 in healthcare costs. This is an incredibly high return on investment program. And these kind of programs have been shown to prevent 14,000 premature deaths, save $2.4 billion in annual medical costs. Oh, sorry, this was a study that looked at several years, not annual. Sorry about that. And $9.5 billion in productivity losses. So the point being is that we are not just cutting direct access to healthcare through Medicaid. This bill is cutting programs that are known to promote health and prevent disease. So there's multiple impacts on health. Okay, I'm gonna keep rolling, David, unless you interrupt me. So the SNAP and farmers. So this one, I'm not talking a lot. I'm not going to go into any sort of into depth because I know you all are experts at RAFI. You do a lot of talk about, and you know best about impacts to like agriculture in your communities. But just to elevate a few things about the cuts to SNAP specifically and our farming communities is that, okay, so a few things that are just known, that we've known for a while, right? So every dollar of SNAP generates between $1.50 and $1.80 in like local economic activity, right? Because people are spending their money, they're spending it on food, they're spending it on food that also benefits like processors and distributors and the grocery retailer and all of that. And in general, not just SNAP, but and this is actually a little high to be honest, but up to 25 cents on every dollar spent on food goes back to a farmer. And again, it depends on the food. And in some instances, that's actually very high. But say max 25 cents on every dollar spent on food goes to the actual farmer that grew that food, right? So this is a situation in which we're working. So now what we're talking about decreasing the amount of money people have to spend on food. So the House Agriculture Committee, the Democratic House Agriculture Committee, when this budget reconciliation was coming out, did their own analysis, pulled all this data together, and elevated a few things. That one is that this is interesting, is that for every dollar cut from a person's SNAP benefits, like say you get $4.50 a day and it goes down to $3.50 a day, for example, shoppers cut their food purchases in half, not by a dollar, but it compounds the effects. So say you have now $3.50 a day instead of $4.50 a day, and you were going to spend, say, $20 on food purchases that day. Now you're going to spend $10 in food purchases that day. So it is this compounding effect that it's not a one for one, right? Because it decreases the purchasing power, but it has many other effects on people's awareness and thoughts and acknowledgement, like what they're able to spend food on. And people start living in a much more restrictive environment and acting as if they do, and really are safeguarding some of their money. So there's this kind of compounding effect when you cut SNAP benefits. And so the House Ag Committee, when they did this study this spring, early summer, they found that this budget reconciliation would eliminate $30 billion in farm revenue due to SNAP cuts alone. So if you look at people spending on food, how much on the dollar goes to farmers, we're talking about cutting $3 billion over the next 30 billion over the next 10 years just to farmers because of the decrease in purchasing power for food. The last thing I want to flag here is that also there's just some SNAP programs that are specifically meant to support like small and local and diversified farmers or local farmers. And those are things like SNAP incentives. So I mentioned we run two different SNAP incentive programs here in Colorado. They're called Double Up Food Bucks and Florida SNAP Produce Bonus. That doesn't matter, but they're extra dollars to buy produce, often from local farmers here in Colorado. And obviously, like we're very concerned, as I'm sure everyone is. And we offer these programs at 150 locations. 250 farmers in Colorado accept either Double Up or Colorado SNAP Produce benefits, one or the other. And now we're going to be seeing a decrease in purchasing power of those SNAP dollars. And so, we don't know, we are hypothesizing, but then we may see a decrease in participants in programs like this and farmers getting fewer SNAP dollars and fewer SNAP incentives as well. And then compounding this is that loss of SNAP education here in Colorado and many other places. We use SNAP education to connect lower income shoppers with farmers markets, with farmers. We do tours at farmers markets, how to shop on a budget, how to find local, how to cook seasonally, how to cook locally. It is like it's the web that we sort of weave around all of these programs. And now there's going to be no support to really connect those shoppers to farmers and farmers markets and eating seasonally and locally. Okay, so I have one more. I know it's a lot of talking. Excuse me. So one more in terms of like, what are these multi-layered, impacts by just, simply by even like the cutting the SNAP program is just to food access in general. So I think there was a question about this earlier as well about the impact. Someone worked at a co-op, I think, worried about losing some of your customers. We certainly have a lot of small retail partners and large retail partners that are really concerned about the loss of revenue coming into their store. And the point is, so when people lose SNAP benefits, retailers lose those food dollars. They lose any SNAP incentives, right? And other food dollars that shoppers would have spent on their store, right? So when SNAP shoppers go to like the farmer's market or a grocery store, wherever, they don't just spend their SNAP dollars there. They use other money too, right? To buy food at that market or that store. So all of those things are going to be hit. So retailers are going to see less SNAP dollars, less SNAP incentives, and probably less overall dollars as well spent at their store. And this is a link, so I can share the PowerPoint. This underline here is actual link to this study. But there was a study that was done since budget reconciliation that says these proposed cuts are projected to affect more than 27,000 retailers, primarily in rural America, in terms of significantly decreased revenue and sales. And then NPR just did a piece, I think like 2 weeks ago, maybe, entitled Independent Grocery Stores Rely on Food Stamp Sales. The new tax bill could impact this. It was specifically looking at interviewing people in Alabama, but effective everywhere. And there was a quote that they shared from a grocery manager in this piece that he says for every dollar spent at a store like his, grocers only net about a penny and a half. The rest gets spent on things like keeping the lights on and restocking shelves for products that either get sold or go bad. Now that some of these SNAP dollars are going away, he hopes he doesn't have to let any of his employees go. And that I just thought was so reflective of exactly what we've been hearing from our retail partners. And the National Grocers Association, which represents primarily smaller, but like independent grocers across the country. But the revenue from SNAP alone was responsible for almost 8,000 jobs across grocery and supporting industries. So again, this is just to flag all of the ripple effects that this is the impacts to individuals, but also to small businesses in their communities. And this is a really long quote that I maybe won't read because it's really long and it's already 10:51. But I became a farmer. This is a quote from actually our coworker, but also a farmer who accepts SNAP and SNAP incentives. And I will share this, but basically she's much more articulate than I am. But she's really talking about how, like, why would we do this, right? These are programs that we created as a society. We ask legislators for them. America asks for these. They're designed to help us and help me as a farmer to help our people. And we've been doing these for decades. And we need like an actual farm bill to be able to keep this amazing work going. So just a quote from a farmer saying like, basically you're doing this to me and my community and we don't want it. So I'm going to do really quickly this and then I'll go back to Menti really quickly just to get some final thoughts. But in terms of actions, I know I did warn you, we're not a lot of time to talk about what do we do about it, but I'm happy to talk about more. So what do we do about it? I don't know what's going on in North Carolina necessarily, but here in Colorado, starting tomorrow, we have a state special legislative session, right? So Nourish Colorado, there are about 4 statewide organizations that do advocacy work in Colorado that all work in sort of like the food security, food access, anti-hunger space. We have been doing an incredible amount of coordination and collaboration together so that we can go to our legislature and say, like, here's what you can do to feed Coloradans. So we have a special legislative session that our governor called because we're now in massive financial fiscal crisis in the state. There's no way we can fill these gaps, but we really want to feed Coloradans. So we've been doing work together to say, how do we do this, right? There's no more nutrition education at that level. There's how do we fill these SNAP gaps? So there's a bill, for example, that we've been working on with some partners that is tied to universal school meals, but also would generate excess revenue that we think can fill at least some of those SNAP administration gaps. And this will all be on the ballot in November. So everything in Colorado hinges on our November ballot, honestly, and voters saying, yes, we are going to vote to pass this like huge investment in universal school meals and filling the SNAP gap and making sure we're doing what we can to feed Coloradans without these federal resources. So that's where our efforts have really been focused right now is our state agencies, our state legislators. We're working with the governor's office and really getting organized with peer organizations. Like we all have different priorities, but it is not time to be competing, right? Like I don't care if you're with the food banks or you're with, doing work like direct with farmers, like we are, whatever, like we all need to get together right now and say, these are our top three priorities to like keep our people fed. We will continue to explore federal options, right? And obviously, Rafi engages significantly in federal advocacy. It's not ever the time, however hard it is, to like let up with our federal legislators, right? Like we eventually are going to need a full and comprehensive farm bill. The only way out of this is by getting a bipartisan, comprehensive farm bill, right? That restores SNAP education, restores SNAP funding, really, keeps our federal government committed to what it's supposed to be doing to take care of its people. Um, and then I'll just skip to this last bullet here too, is that one thing that we are doing is, again, not letting up on elevating our story, mobilizing, talking, sharing. Like this is right now is the time to meet with all of our legislators, Democrats and Republicans, and keep them emboldened and empowered with data and statistics and stories. Keep doing site visits, keep inviting people to see your amazing work. Go to DC when you can, meet with your legislators, tell those stories, bring community partners, keep saying like, this is how federal impact benefits me in my community. And this is what we have lost, right? And this is how what this does to me that's going to change. And keep telling those stories, and don't let up. So that was very fast, I realized. So I was going to switch to one last Menti question just to get some kind of last thoughts. But David, as I do that, is there anything going on in chat that I should be aware of?
We have a couple questions popping up. So
Yeah,
if
we
you,
can do both at the same time. Yeah.
okay, cool. All right, let me see if I can go back to the top and make sure I get them all. One
And
person,
just as we do that, sorry, you could chat in. So like, this is just something I'd like to know as we go. So please let me answer questions. Hopefully you can I'll access the Menti link again. And I'm just wondering, like, what's one thing like we, all of us, you should do with this information? I would just love to get some of your thoughts. So please chat in as I address this question. Sorry, David.
no, you're good. Couple ones right quick. Could SNAP funding be reinstated federally in a few years?
Yes,
One person asked.
100%. So yeah, that, as I said, that has to happen through the Farm Bill. We need a bipartisan, comprehensive Farm Bill to do that. And that is not going to happen this year, probably not next year, probably not after till midterm. And it might actually benefit to do this after midterm elections if we can change the makeup of Congress to people who are more inclined to pass a bipartisan farm bill that feeds people.
Two people wrote in, do you anticipate there would be cuts, the cuts to SNAP are going to affect food cost?
No, I don't think there's a strong correlation there. I think that food banks are going to be incredibly overwhelmed. That's a good question.
Thanks. And then someone else wrote in something about an NC State special legislative session, which I'm do not believe is happening. But we will
Okay.
definitely make sure that that's correct. I don't want to say that without knowing for sure.
Yeah.
And we can have that in the follow-up email.
Yes, that'd be great to know for your all sake if you're doing that or not, because that's your opportunity to say, okay, North Carolina, what are you going to do about it? Because this is, I will say, this is not a gap philanthropy can fill. It just isn't. Like our philanthropic partners are great. I think they're trying to support like planning and collaboration and strategy when they can, but philanthropy will never fill the gap left by public money.
Definitely throw some stuff in the Menti if you have, or chat your questions.
Yes,
While people
please.
are doing
Are you
that, I'm
able
gonna
to?
put
Mhm.
a link in the chat that is another place where it's a evaluation where you can also leave questions as well, because we know we have a lot to follow up with folks on. But yeah, feel free to drop last minute questions here on what
Yeah.
either answering the Menti or just any follow up questions you might have for Wendy.
You're seeing too much of my. I'm trying to see because no one chatted in, which is maybe that's all that's going on. But are people able to?
There goes one. Yeah.
Oh, okay, good. Okay, good. Okay. So yes, please, it'll stay open. We would love for you to just one thing we all of us should be doing this information. I'd love to learn more from that. So I don't need to share though. Please keep chatting in. Okay, and it's working, right? Is it not working for anyone to answer the mentee question? Okay, I love it. So there's a very busy chat. Oh, can I answer this last one? Is that okay? How do you respond to arguments? Corporation tax cuts will pass savings on to customers. I'm sorry, it's just kind of laughable because they never have. Commodity agriculture incentives will help feed more people because it will make food cheaper. So I do not have time to respond to those really well, but I would. Can I just follow up with some thoughts on that? So when people say things like, well, the tax, I mean, this is like Reaganomics, trickle down economics that has literally never worked, but and the commodity ag incentives help feed more people. I can send a list of which commodities specifically are eligible for increased subsidies, and it's not food for human consumption. And that you can say. The subsidy, the $54 billion increased subsidies do not go, and like some of them do might go to peanuts might be in there, but that's honestly, those are massively export crops for us. And I think corn is in there, but that's corn for feed. It's not corn for human consumption. Cool. Um, anything else? We have 1 minute. Thank you for anyone who's chatting and things on the Menti. I really appreciate it because I really do love learning from you all as well. Like, what is something we could be doing or we should be doing on this?
If we didn't get to your question in the chat, like if it because it was pretty active, go ahead and speak up and unmute and ask it in case we missed it.
Did I miss the entire meeting?
Did you just now join?
Yeah, I messed up.
Oh, it's okay. We'll send you the recording. I'm sorry.
Okay, please send me the recording, and I have the paper too. So I'm going to read the paper, and I would love it. Please, you all have the email addresses, correct?
Yeah, we got the email addresses. That's no problem.
Okay. Gee whiz. Y'all have a good day.
Thanks.
Well, Wendy, thank you
Yeah.
so much for
Of
leading us
course.
through today. So much good information, and I think we could have probably done this for 2 hours or 2.5 hours or whatever, because that's how much there is. So I really appreciate your time, and if we could all give Wendy the virtual clap as well as we begin with that. Thank you so much. We
No,
will
of course.
we'll definitely be following up via email with
Yeah.
the slides, if that's okay, Wendy, and
Yep.
the recording to this, and then also information about RAFI's Policy Action Network and ways that you can get plugged in there. Wendy, I did